Thank you, Mr. Chairman and Ranking Member, for this hearing and for following up on this important issue. I really appreciate the subcommittee's continued focus here. I want to thank the witnesses for being here today as well. And I think I want to start by just echoing what you've heard from some of my colleagues. Let's be really clear here. If a sponsor isn't answering a phone call, you don't know where that child is. So you can't tell us there's nobody lost if you haven't had a conversation about whether the sponsor still knows where the child is. And one of the things that concerns me is I hear the words agency by agency represented here, limited responsibility, not our job, not our focus. We don't know once X, Y, or Z happens. That's not acceptable. A siloed response to child welfare is not acceptable. These children are here, and the American people want to know we are doing what we would do for any child to make sure they are safe. And that requires a level of interagency cooperation and a level of cooperation, federal, state, to local government, that is not reflected in your testimony and has not been reflected in your actions. So I want to start, Commander White, with the question about our relationships with the states here. States can do more to help unaccompanied children who have been placed with sponsors if the states know that the children have been placed there, such as providing child welfare services, the information that kids are coming and where they've been placed, and notifying school systems that there are now children in their jurisdiction who should be attending school. But in our last hearing, Assistant Secretary Stephen Wagner said that the agency usually fails to give states this basic information. I'm a former governor, and I find that really troubling. I am well aware that there are sometimes issues between state and federal governments with communication, but the reason that the agency cited for this lack of communication is that you don't know who to contact in the state. And that seems awfully weak to me. The last hearing we had here, one of the DHS representatives said, well, I've got a great relationship with emergency personnel in the state. My suggestion might be to DHS, pick up the phone and ask them who the child welfare person is in the state. Your emergency response people will know that. In New Hampshire, you can call the governor's office, 603-271-2121, and they will tell you who's in charge of child welfare agencies in the state. So what specific steps has HHS taken to get that information? Have you reached out to the governor's offices of states where you're placing children? Have you reached out to the attorney generals or to the child welfare agencies that HHS has relationships with?
Thank you, Senator. So I believe when Assistant Secretary Wagner spoke, he was referring to contacts with local government, which is what was being explored. And I think when he spoke to the difficulty of identifying the appropriate office in each case, it would be, that was about local government.
That actually isn't what I think the record will show. It was a specific question about states. What are you doing to reach out to state governments, notifying them when children are coming into their states and where they are going so that they could in turn, they've got relationships with locals, notify the school systems, for instance?
So I'll take that back for action, but what we have provided, as you know, is summary level information by county each month to the states. But we have not provided individual notifications to states on each reunification of a child. That's correct.
You need to be doing more. And I was given a commitment at the last hearing on this issue that you would be doing more. So I'd like to see you all stepping up to this because, for example, if a sponsor turns out to be a safety risk to a child, despite the best efforts of the federal government to make sure that sponsor is well suited, if that child isn't coming to school and the school knows the child's supposed to be, the school can investigate. The school can save a child from abuse or neglect and trauma, but not if they don't know that the child is there. And it seems to me the very least the federal government could do is provide that information and then follow up on it and make sure it's being distributed. So thank you for the commitment today, and I'll have my office follow up with yours so that we can actually get some specific dates about when we will see a plan for notification to states and local governments and school districts about when unaccompanied minors are coming into their jurisdiction, since you also have said that those state and local entities have responsibility for the safety of these children once they get out of HHS's custody. I'd like to move on to a related issue, which is helping to reconnect families after the Trump administration forcibly took children away from their parents at the border earlier this year. I think we all agree that taking children from their parents is morally reprehensible and an affront to our American values. And pediatricians, psychologists, and health professionals have made clear the lasting harm of these forced separations. Commander White, in testimony before the Senate Judiciary Committee last month, you noted that you and others have raised concerns about separating parents and children based on the, and this is a quote, significant risk of harm to children due to the significant potential for traumatic psychological injury, also a quote. Could you explain what you mean by the significant risk of harm and traumatic psychological injury? What does that mean in practice, and what is the scientific basis for these concerns?
Thank you, Senator. It is well established in the pediatric psychiatric literature as well as in the practice research for child welfare and foster care systems that separation of children, particularly young children from their families, is a traumatic event. There is a significant potential for both short-term diagnosable psychological illness and long-term psychological illness as a result of that traumatic event. That's well supported in the scientific literature. That was what I was referring to, although I think it's probably well understood without being a mental health professional how separating a child from their family could cause them injury.
Thank you. You noted in your testimony last month that you and others, and again, this is a quote, raised concerns about policies that would result in separating families. What specific actions did you or others you know of take to make this argument or to prevent separations?
Again, I participated only in discussions of potential policy outcomes, not in any which followed the policy announcements. We raised concerns through our own leadership. Additionally, I communicated these concerns in interagency discussions. As a reminder, as I said this in the last testimony, our concerns focus both on the best interest of the child, but also on the operational implications for the program and its capacity to serve children. Both of these were addressed in our concerns that we shared.
Thank you, and thank you, Mr. Chair, for letting me go over a bit. I think the best interests of children would be served if you all start working together and really leaning into this as opposed to working in silos and disclaiming responsibility and authority. Thank you.
Senator